Welcome to the lecture on powders. We will start with the USP definition, which states that powders are intimate mixtures of dry, finely divided drugs or chemicals that may be intended for either internal or external use. Now, therapeutically, there are two types of powders. Powders that are used orally or ingested to produce systemic effect, or those that are used to produce a local effect on the skin, like topical dusting powders. Regardless, powders in this context are a type of dosage form. They are a way to administer a drug. However, for most compounded products, the active ingredient is usually already in a powdered form. Whether it comes as a bulk chemical or a tablet or capsule, most of the time the active drug itself is already in a powder form. Many compounded products require us to take that active ingredient powder and to change it into a different dosage form, such as a tablet or a capsule, or even liquefied into a suspension. Nevertheless, in this lecture, we will be discussing the use of active ingredients when prepared and delivered as a dry powder. Keeping in mind that we are talking about powders as a dosage form, we will discuss their therapeutic use. The first use of a powder is when it is applied externally to the skin as a topical dusting powder. Externally, powders can be used as an astringent, or protectant, or anesthetic, or an antimicrobial. On the other hand, powders can also be used by consuming them orally for internal use. Oral powders can be taken by scooping and dissolving them in liquids as a sort of bulk powder. Examples would include antacids or laxatives, including fiber supplements, as well as oral electrolyte mixtures patients use prior to colonoscopies. Alternatively, powders may be dispensed as divided powders, also known as chartulae, or charts. As shown in this slide, when making charts, the pharmacist weighs each individual dose of powder separately on a piece of weighing paper, which is then carefully folded into a packet and placed into a box. At the time of administration, the patient would mix the contents of this packet into a liquid or soft food such as a pudding or applesauce. A chart dosage form is useful when the patient cannot swallow tablets or capsules and the drug is not stable in a liquid form such as a suspension. Lastly, because powders are dry and compact, they can be packaged, transported, stored, and administered more easily than drugs formulated into solutions or suspensions. There are three very important desired properties to have in your final powder dosage form. The first is that the powder should contain uniform, finely divided particles. The reason uniform particle size is important is that particles of different sizes tend to stratify as the product sits between doses. Stratification, in turn, can cause inaccurate dosing. To prevent this, pharmacists use sieves, as pictured on this slide. Sieves are available in different sizes and can be used to obtain powder of uniform particle size. The second desired property is a product where all of the ingredients are homogeneously blended. We will discuss this in more detail, but for now know that homogeneous blending is accomplished by mixing ingredients using geometric dilution. Proper geometric dilution ensures all the ingredients are uniformly mixed. The third desired property is that the powder be free-flowing, meaning the powder is smooth to the touch, non-irritating, and can be spread easily along the surface of the skin. There are some key compounding principles that need to be kept in mind when preparing a powder dosage form. First, ensure all calculations have been performed accurately. While the amount of active ingredient powder is sometimes given in grams on the prescription, more often the amount to use is expressed as a percentage, which must then be calculated. We might also need to calculate for the preparation of an excess amount. Some sources suggest that you prepare an excess amount to the extent of calculating for the preparation of one extra dosage unit, due to loss of powder that occurs during the blending process. In Pharmacy Skills Lab, we will have you base your calculations on the preparation of 10% excess, meaning you will prepare 10% excess powder, but only dispense the prescribed amount. However, as shown in this picture, I will emphasize that careful weighing and handling of powders is needed to avoid loss of product, even when preparing excess. Another key compounding principle for the preparation of powdered dosage forms is the use of comminution, or particle size reduction. In nearly all compounding situations, powder should be in as fine a state as possible. Therefore, unless the solid can be purchased already as a very fine powder, most powders must have their particle size reduced by the compounding pharmacist. There are three main techniques used in particle size reduction. The first and most commonly used technique is trituration. Trituration is defined as the continued rubbing of the powder in a mortar with a pestle to reduce the particle size to the desired degree of fineness. The term is also used to describe the grinding together of two or more substances in a mortar in order to intimately mix them. Trituration is achieved by firmly holding the pestle and exerting a downward pressure while moving in successively larger concentric circles, starting at the center of the mortar and then moving outward to the sides and then back again toward the center. To ensure adequate mixing and uniform particle size reduction, compacted powder is constantly removed from the sides of the mortar and pestle by scraping it off with a soft rubber spatula. An example of trituration is shown in the picture on the bottom, left side of this slide. A second technique that can be used to reduce particle size is levigation. Levigation is the process of reducing particle size by triturating in a mortar, or more commonly by spatulating it on an ointment slab with a small amount of liquid and in which the solid is not soluble. Optimally, the liquid is somewhat viscous and has a low surface tension to improve the ease of wetting of the powder. Mineral oil and glycerin are examples of common levigating agents. An example of levigation is shown in the picture on the bottom, right side of the slide. However, this technique is more commonly used for the preparation of creams and ointments, and therefore will be discussed in much more detail with that dosage form. A third technique that can be used, if necessary, is pulverization by intervention. This method uses recrystallization as the method of obtaining the fine particle size. To accomplish pulverization by intervention, the powder is dissolved in a suitable solvent, often alcohol. Then this solution of the drug and solvent is spread in a thin layer on the sides of a glass mortar or on the surface of a glass ointment slab. The solvent is then allowed to evaporate, which creates a thin film of fine, solid crystals that can be scraped off the glass surface using a spatula. The solid thus obtained can then be blended with other ingredients in the formulation of a powder. Another key compounding principle to employ when preparing powders is the use of homogeneous blending. It is very important to get all of the ingredients mixed throughout the dosage form. The technique used to ensure homogeneous blending is geometric dilution. Geometric dilution is used when blending two or more powdered ingredients of unequal quantities. It is a method designed to help ensure that a small quantity ingredient, which is typically the potent or more active drug, becomes uniformly distributed throughout the larger amount of a second ingredient. Performing geometric dilution requires trituration, which is used because it creates intimate mixing of the powders. To summarize the steps used in geometric dilution, begin by weighing all of the ingredients to be combined. Next, place the ingredient present in the smallest quantity in the mortar first. So if you look on the pictures on this slide, the red powder, which was present in the smallest quantity, was put in the mortar first. Next, estimate a portion of the white powder that is equal to the amount of the red powder and place it in the mortar as well. Next, mix the two equal amounts of powder using trituration until the powders are thoroughly and uniformly mixed. In this example, we can visualize this when there are no longer spots or streaks of white powder and the red color is a uniform and albeit slightly lighter in color. Next, add a second portion of white powder that is approximately equal to the amount of powder in the mortar. Note, this addition will be twice as large as the first. Again, mix the powders using trituration until uniformly mixed. Continue adding powder to the mortar in this fashion, always adding the amount of powder equal to the amount of powder in the mortar until all of the powdered ingredients have been added. An alternative to using trituration for geometric dilution would be to use spatulation, which is the mixing of powders on an ointment slab using a spatula. However, this is not the preferred method as spatulation causes less intimate mixing of the powders, and there is also no particle size reduction. Thus, you would only use spatulation when you are mixing powders that are already fine in particle size, and if you want a final product that is lighter since there is less compacting of the powders compared to trituration. Additionally, spatulation is used when you need to avoid trituration, such as when gently blending powders that would otherwise chemically react if too intimately mixed. We will discuss this type of reaction in more detail when we talk about eutectic mixtures. It suffices for now to know that spatulation can be used when mixing powders to help minimize some forms of chemical reaction. The process of geometric dilution using trituration is visualized again in the video on the next slide.
Okay, today we're going to be doing some geometric dilution. I have calamine, I have talc, and my mortar, pestle, and spatula. Take my calamine and I just toss it right in there. It's 0.2 milligrams of calamine. And I have my lactose, which is my excipient. Remember, when you're doing geometric dilution, you want to take the smallest item you have and dilute it with your excipients. In this case, the calamine is diluted with my talc. So I take about the same amount of calamine I added in there, and I add the same amount of lactose. Make it about 50-50. It's not an exact science. Just eyeball it. Take my mortar and pestle and I triturate it. Now, as you know about triturating, we're breaking down the particle size. We're also doing some mixing as well. So don't just limp wrist this. Put in some muscle. You do gotta put some work into doing some compounding. I like to take my rubber spatula and I like to scrape all the powder off of the sides before I add my next amount of excipient. That way it just gives me a better visualization of how much I have and how much I need to add. So I eyeball it, and again, I'm going to scoop out the same amount that's in my mortar. I'm going to add that in talc. So once I have that, I'm going to mix it. Now I'm going to speed up the video a little bit so it doesn't take as much time, but what you're going to see is I triturate some more, I add more lactose, and I do that a couple times until I get my final mix. Okay, it's also important to note that you don't want to use any metal pieces inside of the glass mortar and pestle. It'll scratch up the sides, mar it up, and allow drug or excipient to get mixed in there and stuck, and that's not good. Now what you're going to see in a little bit is when I add the last of the lactose using my weigh boat, what I'm going to do is fold it up kind of like, it looks like a triangle. That's a really easy way to get things out of these larger weigh boats and even the smaller ones. Flicking it also helps. Just got to watch out for dust in case any flies up. You don't want to inhale any of that or get any of it on you. You're also, if any dust flies up, you're losing drug. So you got to think about that when you're mixing anything. If you spill anything, that the patient is not going to get that drug that you just spill. All right. Now next, I'm going to take my powder that I triturated and mixed using geometric dilution. I'm going to scrape it all down to the bottom, as you can see, and I'm going to place it on a piece of paper. And at the end, I'll compare it to one that I did where I didn't do geometric dilution. But as you can see, it's a pretty smooth consistency. There's no bright pink spots or anything, or really white spots, so it's a good mix.
Up to this point, we have been focusing on some of the key compounding principles and techniques used to prepare powders. However, before proceeding, we need to stop and consider the chemical properties of some of the commonly used ingredients in powders. Specifically, I'm referring to the properties of efflorescence, hygroscopic, deliquescence, and eutectic formation, all of which can affect the compatibility of different ingredients and thereby the overall stability of the final product. Efflorescent powders are drugs or chemicals that already contain water of hydration, and this water can be released from the powder when it is manipulated or stored under conditions of relatively low humidity. On the other hand, an ingredient could be hygroscopic, which are solid drugs or chemicals that can absorb moisture from the air. Going a step further from that, an ingredient can also be deliquescent, which are hygroscopic powders that absorb so much water or moisture from the air that they can actually dissolve and transform from a powder into a liquid. Lastly, there is the potential to form a eutectic mixture, which is illustrated in the picture. A eutectic mixture is a mixture of two or more substances that start off as solid ingredients, such as powders or crystals, but when intimately mixed using trituration, become liquefied. So you start with powders or crystals, mix them together, and because of the chemical reaction that lowers the melting point of each ingredient, the resulting mixture actually transforms into a liquid. In summary, many chemicals have properties that can affect their compatibility and need to be addressed when formulating a compounded powder. We will discuss how to deal with each of these issues in the slides that follow. We will begin our more detailed discussion of compatibility issues by focusing on efflorescent powders. These types of powders are listed on this slide. There are many commonly used drugs on this list, including atropine and codeine salts and morphine. These are all drugs which in their powdered form exhibit an efflorescent property. The problem with using efflorescent powders is that they contain water of hydration that can be released while working with them, especially in areas with low humidity. For example, when mixing an efflorescent powder with trituration, the powder can suddenly become damp and clumpy. Alternatively, a powder that was free-flowing when compounded can become damp and clumpy upon storage, to the point where it cannot be applied by shaking or spread evenly over the skin. So what are the compounding strategies needed to avoid or prevent efflorescent powders from releasing their water of hydration? The first strategy is to store these products in a tight container in order to limit the amount of airflow through the container and thereby reduce the release of moisture. Secondly, when possible, substitute the drug with its anhydrous form. In other words, use the same drug in powder form, but a form of the drug that does not contain any water of hydration. While not all efflorescent powders are available in an anhydrous form, if it is available, consider using it. However, be careful because the anhydrous form of the drug will have a different molecular weight. Take care in the formulation that you make the appropriate dosing corrections if you substitute with an anhydrous drug form. The next compatibility problem to discuss in detail is the presence of a hygroscopic or deliquescent powder in our formulation. Various examples are listed on this slide. A commonly used chemical to point out and remember as a hygroscopic powder is calcium chloride. Hygroscopic powders are powders that can absorb moisture from the air and tend to get damp and clumpy. Deliquescent powders can absorb so much moisture from the air they can actually solubilize themselves and transform from a powder into a solution. Therefore, we must prevent this from occurring in our formulation. The first strategy is the same as for efflorescent powders, namely, to store these powders in a tight container, preferably in an area of low humidity, to limit access to moisture from the air. The second strategy would be to add an inert powder that would preferentially absorb any water or moisture from the air. Depending on the formulation, there may already be an ingredient present that can fulfill this function. Thus, if there is a large amount of bulk or diluting powders in the formulation, they will often preferentially absorb moisture and no other ingredients are needed. However, if that is not the case, then you can add a suitable inert water-insoluble powder. A commonly used example of such a powder is lactose. Lactose does not provide any therapeutic effect but can absorb moisture first and keep it away from the hygroscopic or deliquescent powder. Light magnesium oxide is also sometimes used for this purpose, but has to be used in small amounts to avoid therapeutic effects. When you add extra ingredients for this purpose, you should consult with the prescriber and make any adjustments to the dose or concentration of active ingredients that may be necessary depending on the amount of the extra inert powder that is needed to be added. The third compatibility issue to discuss in detail is the formation of a eutectic mixture. Some of the chemicals known to form eutectic mixtures are shown on this slide. The ones to highlight because they are commonly used in the formulation of topical dusting powders include benzocaine, camphor, menthol, and salicylic acid. A eutectic mixture occurs when two or more solid ingredients liquefy when intimately mixed using trituration at room temperature. One strategy for dealing with a eutectic mixture is to separately mix each of the potential eutectic forming powders with an inert powder. After each individual eutectic former has been mixed with the inert powder, they can be carefully combined using spatulation rather than trituration. The presence of the inert powder and the gentle spatulation can prevent the intimate contact needed for a eutectic mixture to form. However, this strategy is not as commonly used as the force and absorb method. This commonly used strategy is to actually go ahead and force the eutectic liquid to form, and then absorb that liquid into or onto an inert powder. This is accomplished by mixing the liquid eutectic once it is formed with an inert powder in portions until all of the liquid has been absorbed by the powder. If possible, this function of absorbing the liquid should be done using another ingredient already called for in the formulation. However, if there is no suitable powder already in the formulation, an inert powder can be added. Magnesium carbonate is reported to be the agent of choice, but alternatives such as magnesium oxide, calcium phosphate, starch, talc, or even lactose can be used. This method of forcing and absorbing the eutectic is the primary way to handle a eutectic mixture and will be what we want you to do in the Pharmacy Skills Lab. The next slide demonstrates this strategy by forcing a eutectic to form and then absorbing it into an inert powder.
Place the menthol and the camphor in the glass mortar. And triturate to force the eutectic. Continue to triturate. It will become damp. Scrape down the sides if you need to get the drug back into the center of the mortar. Geometrically add the talc to the benzoic acid and eutectic mixture. Continue to add the talc and triturate after each addition. Scrape down the sides if necessary. And triturate till uniform.
Next, we will discuss preparation guidelines for compounding powders. The first guideline to discuss is quality assurance. To ensure the quality of the final product, the pharmacist should document in the compounding record the final weight of the preparation, uniformity of color, particle size, flowability, and any evidence of caking. If dispensing a divided powder, the pharmacist must document individual packet weights as well as compare and describe packet uniformity. The second preparation guideline is beyond use dating. Generally speaking, most powders are quite stable both physically and chemically. However, the properties we discuss, such as efflorescence or deliquescence, may reduce the stability of a final product. Always look for published stability data for any formulation. However, in the absence of stability information, the USP Chapter 7095 recommends that for solid dosage forms, which includes powders, the beyond use date is not later than the time remaining until the earliest expiration date of any active ingredient, or 180 days, meaning 6 months, whichever is earlier. The third preparation guideline is about the amount to prepare. USP Chapter 795 states for powders to prepare an excess amount of the total formulation to allow the prescribed quantity to be accurately dispensed. As we have previously discussed, in Pharmacy Skills Lab, we want you to calculate and prepare 10% excess, but only dispense the prescribed quantity. The last preparation guidelines to discuss are product packaging and labeling. In terms of packaging topical dusting powders, any container used should be considered tight and limit access to moisture in the air for the reasons already discussed. However, as you can see on this slide, there are a variety of different tight containers in which topical dusting powders can be dispensed. Although topical powders can be dispensed in basic wide-mouth bottles, the powder can be much more easily applied using containers such as sifter top, powder can, also called shaker canister. Other alternatives include the use of a plastic bottle with either a flip spout or snap cap, as shown on the far left called a Yorker spout. The choice of the container should be based on how the product is to be applied, and a container selected that makes application as convenient as possible for the patient. As far as expressing the drug on the prescription label, it will be different depending on whether you are labeling a product to be used as a topical powder or used for internal use. To label a powder for topical use, express the concentrations of each active ingredient as a percent weight per weight. So for example, tolnaftate 2%. Alternatively, the amount of drug can be expressed as a metric weight or units of activity per gram of powder. The latter is used for drugs like nystatin, which are not dosed by weight like milligrams, but rather by units. Thus, we would label a powder containing nystatin as nystatin 100,000 units per gram. On the other hand, when labeling a divided powder for internal use, express the amount of active ingredient per amount to be administered. For example, scopolamine 0.5 milligrams in 250 milligram oral powder. Note, the route is always included in the drug name as either topical powder or oral powder. There is also auxiliary labels that should be attached to the compounded powders. Topical dusting powders should have a for external use only label. Both powders for external and internal use should be labeled as stored room temperature as well as keep out of the reach of children, since the packaging is typically not child resistant.